My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH CORE, and it is my pleasure to welcome you today to our 14th webinar of 2015, which is titled, Is CORE Certification Right for Your Organization? Before we begin, I'd like to mention a few logistical items. You can download a copy of today's presentation from the CAQH.org website. To do so, navigate to the CORE pull-down menu at the top of the CAQH.org welcome screen and select the CORE Education Events page. A link to the PDF version of the presentation can be found under the listing for today's webinar. On this slide, you can see a screenshot of the attendee GoToWebinar dashboard. You should see something that looks similar to this on the right side of your computer desktop. When joining today's session, it's possible you may have joined the audio portion of the webinar using your computer speakers by default. If possible, we would prefer you to join the webinar audio by telephone. To do this, please select the telephone audio button in the audio panel of your dashboard, and the dial-in information will be displayed. Make sure you enter your audio PIN, which is found under your dial-in information. We'll save time at the end of today's program to responding to audience questions. You're encouraged to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. We do ask that when you submit your question, you identify the type of organization you're with so that we can give you a more accurate response. We'll also be taking audio questions from the audience over the telephone at the end of today's session. When we begin the audio portion of the Q&A session, you may raise your hand using the hand raise tool found on your webinar dashboard. When it's your turn to ask a question, we will unmute your line and you can begin. Please hold off on using the hand raise tool until prompted to do so, as we will put all hands down at the beginning of the audio Q&A. Once again, in order for your line to be unmuted, you must enter your audio PIN on your telephone keyboard. We would like to take a moment to acknowledge and thank our speakers for joining us on today's webinar. Today we have Roger Widner with the Office of Main Care Services, Kelly Proctor with Molina Healthcare, Pam Grosset with PNC Healthcare, and Puneet Arora with Edifex. Thanks so much for joining us today. Today we have two very interesting case studies, one from a state Medicaid agency and another from a healthcare vendor. After that, we'll have a demonstration of the CORE certification test suite. And finally, we'll have some time to take your questions. But first, let's take a quick poll. The question is, do you anticipate your organization will become CORE certified? The answers are yes, unsure, no, not applicable to my stakeholder type, and already CORE certified. Please take a few minutes to answer the question. I'll give you a few more seconds. So as you can see, most people answered yes to the question. I see a large number of unsures, and one thing I'd like to point out is if you need any information, please go to our website, email us, give us a call, and we're happy to help you in making your determination. So let's start today's session with a brief presentation and introduction from CAQH CORE Senior Associate Taha Anjarwala. Taha?
Thank you for the introduction, Jessica, and good afternoon, everyone. First, I'll be providing a brief overview of the voluntary CORE certification to kind of set up context for today's webinar topics. In background, CORE certification means an organization has demonstrated that its IT system or product are operating in conformance with a specific phase or phases of the CORE operating rules. The phases include Phase 1, which covers the eligibility transaction, Phase 2, which covers the eligibility and claim status transaction, and Phase 3, which covers the EFT and ERA transactions. The CORE certification program was developed using a multi-layered approach to assure an independent, industry-developed confirmation of conformance with the operating rules. Further, the CORE certification seal has been proposed as an option for documentation of compliance in the ACA-mandated health plan certification of the compliance proposed rule, indicating the value of the CORE seal. Next slide, please. So next, I'd like to transition our discussion to talk about the relationship between core certification and state Medicaid agencies. State Medicaid agencies benefit from voluntary core certification by gaining assurance that they are conformant with the federally mandated operating rules, by positioning themselves as leaders in administrative efficiencies, and by lowering costs within their claims processing systems. To date, 3 state Medicaid agencies have achieved voluntary core certification across the various phases, and these agencies include Florida Division of Medicaid, Alabama Medicaid Agency, and MaineCare, who we will be hearing from later on today. Additionally, there are 4 additional state Medicaid agencies that are already in the progress of working to achieve voluntary core certification. Next slide, please. So in evaluating the core certification process, CAQH CORE staff has compiled feedback that we received from state Medicaid agencies and have identified unique issues related to Medicaid. 2 of these issues pertain to the areas of patient financial responsibility and benefit eligibility. So for example, many Medicaids offer $0 deductibles, which often is initially seen as a challenge when Medicaids are trying to complete core certification testing. But from the feedback we received, Medicaids have indicated to us with the use of the available resources listed below, organizations have been able to resolve a lot of their key challenges with core certification testing. So some of these examples include the CAQH CORE Analysis and Planning Guide, which helps identify system and software gaps, FAQs, which address a lot of the technical rule requirements, and the core certification test suite and the master testbed data, which kind of go into stakeholder-specific requirements for testing. Next slide, please. So as an introduction to our next speaker, MaineCare, I would like to highlight their relationship with CAQH CORE. In December 2013, MaineCare began to pursue voluntary core certification for phases 1 and 2, and later achieved core certification on those phases in September 2014. To achieve core certification, MaineCare worked closely with their fiscal agent, Molina Medicaid Solutions, to implement the CAQH CORE operating rules. And likewise, if your state Medicaid agency is interested in pursuing core certification, you may contact your fiscal agent. And now it's my pleasure to introduce Roger Widener, who has been with the Maine Integrated Health Management Solution Project Manager for the Office of MaineCare Services for the last 3 years. Prior to that, he worked at the Maine Revenue Services for 7 years as project manager on 2 large system implementations. All right, I'll pass it on to you, Roger.
Thank you. Good afternoon, everybody. Next slide, please. So the Office of MaineCare Services is the state Medicaid agency for the state of Maine. Our current active member population is approximately 280,000 members. And we serve those members by coordinating the various programs and benefits that fall under the Office of MaineCare Services. We administer policy, and we partner with approximately 4,500 MaineCare providers throughout the state. And as mentioned earlier, since 2010, OMS has partnered with Molina to be the state's Medicaid fiscal agent. And so they do all of our systems work, and they work very closely with us on our CAQCH CORE Phase 1 and 2 projects. Next slide, please. As part of our project, we identified several benefits associated with the implementation of CAQCH CORE Phases 1 and 2 and with the core certification process. Those benefits include enhanced interoperability between our providers and MaineCare, improved customer ease of use, and facilitated real-time access to eligibility and claim status information. Compliance with the provisions of the ACA was certainly a significant driver for the project and our certification process. We believe that the certification process helped us to ensure full compliance, and the issues that we identified and resolved during testing improved our overall solution. So that's kind of a brief overview of very high level of MaineCare and the benefits that we hope to achieve as part of our project. At this point, I'm going to turn it over to Kelly Proctor with Molina for the rest of our presentation. Kelly?
Thank you, Roger. If I could have the next slide. So we wanted to bring to the group today some of the key changes that had to be made to our system that's implemented for processing main care claims because of the CAQCH CORE Phase 1 and 2 regulations. So I think, as Taha referred earlier, one of our key changes was to reporting co-payment patient responsibility on the 271 transactions. That was a big one for us. Also allowing real-time access to 271 and 277 transactions. The name normalization that's required by Phase 1 on the 271. Date ranges that are allowed for eligibility inquiry on the 270. And we found that we had to do many, many updates to the service type codes in the current configuration of our benefits within our system. Next slide. So then we wanted to kind of quickly go through sort of a timeline just to give folks an idea of how long, this project takes and certification. For us, we actually kicked off the project for Phases 1 and 2. CAQCH CORE Phase 1 and 2 implementation were done together in November of 2012. And it was actually 9 months in August of 2013 before we were fully implemented. And we went through a 90-day stabilization process. We remediated some defects. We selected our authorized testing vendor for certification. We worked very closely with the state to complete the gap analysis worksheet, which again, Taha referred to in the materials that were very helpful. The gap analysis actually identified a defect for us that we then remediated. Then we felt that once the system was stable in December of 2013 with the newly implemented changes, the state was then comfortable signing their CAQCH CORE pledge forms and getting those submitted. We then spent a lot of time analyzing the testbed data to perform certification testing and loading that testbed data into our testing environment. In March of 2014, we actually completed the online tool registration, and Edifex was the authorized vendor that Maine selected to use. And if I could have the next slide. We began our Edifex testing in April of 2014, completed it in June of 2014, received our results in July, and applied for the CAQCH CORE seal in August of 2014. And we actually, Maine Care received that Core Seal application approval in September. So you can see it was quite a lengthy process from start to finish for full implementation and certification. But we did some strategic things along the way to make the process a little bit easier. Next slide. So some of the strategic decisions that Maine and Molina made as we went into this. One of the things that we did was we identified the core certified entities, and we requested their assistance in pilot testing.
Kelly, are you there? You might have hit mute.
No, I didn't.
Roger, are you there?
Can you hear me?
Oh, sorry, you cut out for a little bit. Please continue.
Oh, I'm sorry. Okay, so one of the strategic decisions that Maine Care made was contacting core certified entities to request that they pilot test our system. So Maine Care and Molina partnered to actually reach out to a few core certified entities to see if they'd be willing to submit 270s using our test system to help us pilot test before we actually went live. The other critical strategic decision we made was we had to reach out to CAQCH CORE to get clarification on several things, but this one in particular. In the rules, it states that you have 180 days from the time you sign your pledge to achieve certification. That's 180 business days, and that isn't clear in the rules, so that, gave us a little more time to work with. We had previously established a vendor relationship. You know, Melina and the state, we have worked together for 3 years before we went into this endeavor, so we are very comfortable working on large projects together. Early establishment of the testbed data, I can't stress this one enough, and early establishment of communication with CAQCH CORE, and in our case, Edifex was the vendor that was selected. That communication was vital as we ran into challenges along the way. The testbed data, examining that testbed data and getting it loaded into your test environment is a big step. I think this was probably one of the longest parts of the process for us, was understanding how to use that testbed data, how it related to us as a Medicaid agency and a fiscal agent. All right, next slide. So challenges. Copay, again, Medicaid had typically never, or in my experience, had never reported copayments out on the 271 transaction. MaineCare uses a sliding scale copayment structure. So based on what the claim is paid determines how much your copay will be. So this was a very challenging aspect for us to implement with CAQCH CORE, but we were able to partner with CAQCH, X12, CMS, numerous people to come up with a solution that was able to be certified in the end. Again, as I spoke to earlier, determining how to use the testbed data and load it. During testing, we actually ran into a couple of validation issues with Edifex. We actually used the Edifex tool for validation of our EDI transactions, and we were getting a fail in some of the testing for certification, and because we had established such a good relationship with Edifex and we were able to pick up the phone and call them and those lines of communication were open, we were able to adjust some of the edit settings in our validation and get through the testing. And one last minor challenge was that it says to mail your approved test results along with your Core Seal application, and Edifex had sent the test results directly to CAQCH, so Melina had to request a copy of those to submit with our Core Seal application. Little bump. Again, opportunities, great open lines of communication with CAQCH CORE representatives. They were supportive throughout the entire process, and we, can't thank them enough. Same for Edifex. We opened lines of communication early with them, contacted them early, and very helpful throughout the process. Everything we needed was provided by both of those teams, and it is a self-paced testing process. So you have the 180-day limitation, but other than that, you can align your resources to perform the certification testing when it works for your organization. Next slide, please. So now, Phase 3, MaineCare and Melina have been working in partnership again to implement Phase 3. We've been working on this project. We kicked it off in August of 2013. We went live with Phase 3 just last month, and we're in the stabilization period now. We're approaching the end of that stabilization period, and everything is going well. We are preparing for core certification now for Phase 3. We've established our work plan. We've started looking at the CAQCH CORE test cases for Phase 3, and we're preparing our documentation and getting ready for MaineCare to sign the CAQCH CORE Phase 3 pledge documents and get those submitted. So that just gives you a feel for where we are today with the CAQCH CORE implementation. And next slide. And that's it. And I think it's back to Jessica, although this says Matthew, right?
Thank you so much, Kelly, and also to you, Roger. Thank you for your presentation. So let's continue with our session with another presentation and introduction from CAQH CORE Senior Associate Matthew Albright. Matthew?
Thank you, Jessica and Kelly, Roger, and Main Care. We're very excited that you're pursuing phase 3. That's great stuff. Before I introduce the next guest, Pnc Bank, some of you may be asking how Pnc, a financial institution, came to be core certified. To answer that question, I'm going to spend just a moment talking about the types of entities that have become and can become core certified, and then talk about a specific type of core certification for vendors and their products or services. The table on this slide demonstrates two things. First, it shows the 4 general stakeholder types that can become core certified: health plans, providers, clearinghouses, and vendor products or services. Second, it lists some examples of organizations that may be categorized under those stakeholder types. Next slide, please. This slide summarizes aspects of the entities that are eligible for voluntary core certification. Any and all entities that create, transmit, or use the administrative transactions are eligible for voluntary core certification. As we saw on the previous slide, this certainly applies to HIPAA-covered health plans, clearinghouses, and providers, but it also applies to non-covered entities that conduct parts or all of a particular transaction. Voluntary core certification is also offered to specific vendor or clearinghouse products or services that meet the CAQH CORE operating rule requirements. Good examples here are PMS and EHR systems for the provider, and a multitude of other software and services that are offered to health plans. The takeaway here is that regardless of how you categorize your organization or your product, be it clearinghouse, billing agent, payment service, if you help health plans or providers conduct the eligibility claim status or EFT ERA transactions, then you are eligible for voluntary core certification. And here's where we answer the question: how does a bank like PNC come to be core certified? PNC was certified as a vendor because they offered a specific service to health plans to facilitate the EFT ERA transaction in a conformant manner. Next slide, please. So we've seen the what. Now let's look at the why, and why specifically would a vendor want to get its product or service core certified? The main reason is that both vendors and clearinghouses benefit by adding value to their products and services. Their customers are looking for products and services that are compliant with federally mandated requirements. Now, HIPAA administrative simplification has not historically been strongly enforced by the government, but we may be experiencing a shift in this approach. We have seen it with some of the mandates in the Affordable Care Act, including the ACA mandated HHS health plan certification. And I know many of you that registered had questions about what the status of that HHS health plan certification is, and we hope to get to that at the end of the webinar. The ACA also requires the Secretary to conduct periodic audits. Finally, we've seen that in the last 9 months or so, CMS has created a division called the Division of Administrative Simplification Compliance, which seems to be a harbinger of things to come. And we'll note that in relation to the broader field of federal enforcement and compliance, we heard recently that a core certified company uses their core certification as a way to support their Sarbanes-Oxley audits, specifically the IT audits derived from Section 404 of the Sarbanes-Oxley Act. So you may want to ask your auditors, those charged with IT audits for SOX, if core certification would help facilitate the audit or help with the internal control report in some way. Next slide, please. A good way of thinking about the vendor's role in core certification is to think about the concept of drafting. For some of you that may be cyclists, sailors, or race car drivers, you know that drafting or slipstreaming is the technique where you slip behind the bike or vehicle in front of you in order to reduce the effective drag or wind resistance. The idea is that that lead vehicle takes on the headwind, thus conserving energy and resources for those drafting behind the lead. So, in cycling terms, PNC is leading the peloton. As we'll hear in a moment, PNC obtained the core seal this year for one of their products that is specific to the EFT and ERA transaction. That is a characteristic of core certification seals for vendor products. Unlike a health plan that must be certified in all 3 phases, all 3 transactions, vendor products can be certified solely for the transaction or transactions which they facilitate. And now it is my pleasure to introduce Pam Grose, who is Vice President and Senior Product Manager for PNC's Bank Healthcare Division. Pam has more than 20 years experience in the healthcare industry and plays a leading role in industry organizations such as ASC, X12, and WEDI. And aside from her formal roles, Pam has been a great advocate for administrative simplification for many years. As well, I'd like to mention that PNC as an organization has also been an active proponent for Admin Sim. PNC was instrumental in the early development of EFT standards and operating rules. Pam, we're very happy to have you here with us today.
Thanks, Matthew. Next slide, please. Well, I just wanted to take a moment and introduce Pnc Bank. Just in case you aren't familiar with our organization, we are the 7th largest bank in the United States. Primarily, our retail presence is primarily in the eastern half of the United States, but we do have offices all across the country. Next slide, please. We also have a very strong commitment to healthcare. PNC does have a healthcare division. We have over 1,900 healthcare clients across the country. We have a dedicated healthcare staff focused on our healthcare products and services. That includes more than 25 years of experience developing solutions specifically for the healthcare industry. We're one of the largest national lockbox providers, and we're the only bank that holds the ENAC accreditation for both our healthcare clearinghouse and our healthcare lockbox services, and we're the only bank that holds the CAQH CORE seal for our Remittance Advantage product. Next slide, please. We offer solutions across stakeholder groups. We have solutions that are both provider-facing and payer-facing. We have a fully integrated suite of revenue cycle management tools for providers, and that does include clearinghouse services. And we also offer payers a disbursement solution that offers remittance information and payments to their provider networks. So as we started looking at core certification, we needed to look at the type of core seals that are available. And just to review what Matthew had mentioned previously, you can become a core certified health plan, a core certified vendor, and that is product specific. You can be a certified clearinghouse, which is also product specific, a certified provider, or you can be a core endorser, and that's for entities that do not create, use, or transmit the HIPAA transactions that are mentioned in the operating rules. Next slide, please. So we had the opportunity to obtain multiple core seals of multiple types. We needed to look across our product suite and determine what we wanted to do. We could have gotten a vendor seal for multiple products, or we could have gotten a clearinghouse seal. We made the decision to focus our certification efforts on one product only, our payer-facing product, so that we felt like that was the most urgent to become certified to help our payer clients. The reason we made that decision is because our payer clients are facing the requirement for health plan certification potentially by December 31st of this year, based on what's in the current proposed rule. And of course, that is pending a final rule, but the proposed rule does say the end of this year. There is language in the proposed rule that requires business associates to obtain a core seal if their health plan partner chooses the core seal route for certification. The proposed rule includes two ways for health plans to become certified. One is to do a HIPAA credential process, which CORE has been developing, or the other alternative is to do the existing core seal certification. And again, if the health plan chooses that core seal option, any business associates that they have also need to have a core seal, per the language in the proposed rule. We also felt like whether our health plan partners went through that because of the mandatory certification or if they chose to voluntarily certify, our having a core seal would facilitate that certification process for them, for all of our payer clients. Next slide, please. So as we started looking at the requirements, what we saw was that the core vendor seal testing process is currently geared towards provider-facing products. All of the testing requirements were very oriented towards provider-facing products. So we consulted with both CORE and EDIFX to determine what type of seal would be appropriate, and looked at all of their requirements, talked through what our product did versus what how we needed to certify. And what we ultimately determined was that we would use the health plan seal testing process to achieve a health plan vendor seal. So we ultimately received a vendor seal, but we used the health plan testing process to receive it. And as Matthew mentioned, our product is for ERA and EFT only, so we only needed to do Phase 3 certification because Phase 1 and 2 did not apply. Next slide, please. As we looked at the benefits of certification, as I mentioned earlier, we really felt like this would facilitate the certification process for our payer clients. As Matthew mentioned, the drafting concept, that if we had that core seal, then our payer clients that used our services would be able to benefit from our initiative to help them more easily certify themselves. So we really felt like that would be a major benefit for our health plan clients. And then we also felt like, knowing that that language is in the proposed rule, that any payer health plans that were going to do the core seal for their certification method, we would need to have a core seal as well. So we wanted to proactively have that so that we would not be behind the curve, so to speak, trying to make that happen with such a quick deadline that's currently in the rule. And just in general, we felt like this validated our conformance with HIPAA standards and operating rules to demonstrate to our payer clients the quality of the products that we offer. Next slide, please. So to start the process, we had a call with CORE representatives to talk about our product and what it does, talk through the testing requirements, and answer questions both from PNC and from CORE. We really had a lot of discussions to talk through this and determine what type of testing process we needed to do and what the requirements would be for that. Once we understood which process and testing suite we needed to use, I went through and downloaded and reviewed all of the materials that are available on the CORE and EdFX websites, and that includes the certification test suite. There's a lot of documentation available, and it's very beneficial and very important to review that to understand exactly what requirements need to be met in order to become certified. Based on the requirements that were outlined in the certification test suite, we began an internal gap analysis. I went through the certification test suite in a very detailed manner, documented all of the pieces of documentation that we were going to need to supply, all of the actions we were going to need to take, anything we needed to upload to the EdFX site, made sure all of that was documented, and then we analyzed what we were going to need to do to be able to supply that. And what we found was that most of those requirements had already been met because we did a lot of proactive work to ensure that we were compliant prior to the rule compliance date of January 1st, 2014. So we felt like we were in pretty good shape, but we only knew that because we did the gap analysis and the review of the certification test suite to see what the requirements were going to be. Once we knew what those requirements were, then we engaged the appropriate teams, and that included our legal team to look at all of the documentation we had to submit as well as the forms we had to sign, our MIS team to help facilitate some of the work that was needed, and our telecommunications team to help us with the process of transferring the files. Next slide, please. We completed most of the requirements for certification prior to signing our core pledge. You can sign the core pledge at any time, and we wanted to make sure that because once you sign the core pledge, that clock starts ticking. As Kelly mentioned earlier, we wanted to make sure that we allowed time for any competing priorities that might come in. We wanted to make sure we were not going to have a problem with that time constraint. So we did most of the requirements prior to signing the core pledge. That made sure our telecom team had enough time to establish the connection to EdFX to upload our files, and gave our MIS team enough time to pull and de-identify the files that we needed to upload. We found that some of the requirements in the testing suite didn't really fit because we are not actually the health plan, but we're the business associate of the health plan. So we struggled a little bit with how to meet those requirements, had to consult with CORE again, but what we determined was that those types of things were actually covered by our HIPAA attestation. So we were able to work past those challenges, again, because we were not exactly fitting into the type of the testing requirements that were there. Once all of the items were complete, then we applied for our core seal. We submitted all the required paperwork and, of course, the fee. Next slide, please. Like everyone, we had challenges around the allocation of resources. We have a lot of competition with other projects, so that was one reason why we were concerned about the time frame with between signing the core pledge and submitting all of the documentation. We wanted to make sure that we allowed for any stops and starts that might be needed. So that was a challenge for us, just like it would be for anyone. Our biggest challenge was fitting into the existing model because we're just a little bit different type of organization. The vendor certification didn't fit. Some of the items on the health plan certification didn't fit as we were going through the testing process. So that caused a little bit of a delay in getting started while we were trying to figure all this out and trying to get set up correctly in EdFX so that we had the correct testing options to go through and all of the correct places to upload information. And in fact, we encountered some quirks in the EDIFX system where we could not upload documents when we needed to, but we were able to enter comments and work around that. So we were able to rectify that. Next slide, please. But really, working with the CORE resources really helped the process go very well. CORE resources were readily available to answer questions and provide any assistance that we needed. So it was really helpful and really helped it go very well. Because we have a combined ERA and EFT enrollment process, in many cases the screenshots or documents that we provided would meet multiple requirements. So it actually reduced some of the workload that we had to get through the process. The testing process is very self-directed, and we could proceed at our own pace, and that helped us a lot. If we did have a competing priority jump up, we could meet that and then get back into the certification process very quickly. So it really helped to walk through this at our own pace. We originally started researching the process in June of 2014, and we applied for our core seal in November. Most of that time between there was doing our upfront research and gap analysis, and that's really, really important to do that upfront work so that you have everything lined up and ready to go once you actually start the process of working through the test suite and getting things uploaded to the site. If you do all of that upfront work, then the actual certification process goes very, very smoothly. Most of our work on the actual certification process occurred in September and October, and again, it went very smoothly. Next slide, please. And this is where you go to actually find all of the documentation. As I mentioned, there's a lot of documentation available, and walking through that, doing your upfront gap analysis really helps you become prepared for what you have to do for certification. So I certainly would encourage anyone to go here and get started on certifying. So Jessica, I'll hand it back to you.
Thanks so much, Pam. I really appreciate the time you took to tell us your story. So let's take 1 minute to do another quick poll. The question is, how many of your trading partners or product services are core certified? And the potential answers are all, some, none, I don't know, and not applicable. So let's take a few seconds to answer this question, please. I'm going to give you a couple more seconds. Thanks so much for your feedback. As you can see, there are a lot of folks that are not sure what products should be or services should be core certified. So I will tell you that, again, we are a resource for you, and then also talk to your vendors, talk to your business partners, and find out. But again, please, we're here to help you if you need any help with that issue. And now I'd like to introduce and welcome Puneet Arora. Puneet has been working with EDIFX first as a senior business analyst, and before then as a functional analyst in the services department for about 1.5 years. He's been supporting CAQH core certification testing portals for phases 1, 2, and 3. And he is the first point of contact for all the organizations who apply for testing and certification with EDIFX. Puneet is going to do a live demo of the CAQH core testing portal. So Puneet, please go ahead and begin when you're ready.
Thank you so much, Jessica. A very warm welcome and good afternoon to everyone. I hope you can all see my screen now. All right. So before I start, I'd like to call out the special relationship that EDIFX shares with CAQH, and would like to thank CAQH for that, as we being the first and currently the only authorized testing vendor for core certification process. And we have been, providing this hosting services for EDIFX testing portal since 2008 for all 3 phases for phase 1, 2, and 3. and we have assisted many organizations to get through the process of certification and get Core Seal certified. So as I start my demo for Core Testing Portal, I'd like to ensure a couple of takeaway items for all the attendees to take away. One would be the contact details and go-to point of contact for any assistance that you might require for Core certification, or any assistance that you might require or your organization may require for getting Core compliant or OR compliant for that matter. Secondly, I'd like to give you an overview of the Core Testing Portal to make you familiarized with the easy process of getting certified with EDIFEX Testing Portal. So with starting process, as you can see you can see the EDIFEX official website, and walking through the right menu where you can reach out to an option called Client Login. I'm going to walk you through slowly wherein you can reach out to EDIFEX Testing Portal. So as you scroll down, you can see a section which talks about Core Phase 1, 2, and 3. And you'll see two exclusive portals for Core Phase 1 and 2 being together, and Core Phase 3 login as a separate portal for it. I'm calling it out explicitly that both of these portals share exact same user experience. So, getting familiarized with them would be easier for you guys. I'm going to go ahead and do a walkthrough of Core Phase 1 to login for now. So as you see the login page of Core Phase 2 login, you'll see a quick content about it and the member login details here. So you can see a quick start guide available for all the organizations, wherein it provides you a handy booklet of all the details that you might require when you're getting started with Core certification process and the EDIFEX testing portal. It also serves the purpose of answering all the FAQs that you might be wondering while starting the Core certification process. So for any entity who are you planning or you are getting started for Core certification, here is your link where you can go here and click here to register. I'm going to click here and quickly show you a simple process how you can get registered. So it's a simple wizard-based process where you just need to provide the details of user who will be shouldering the responsibility of certification from your organization and about the organization. So only the key areas, as Pnc mentioned and other organizations, the key area is to understand the stakeholder type and the type of transaction that you're dealing with. So before you head off with the registration process, we always recommend you to ensure what kind of stakeholder type that you will be doing the certification or applying for Core Seal. And at any point in time before registration, our contact details are available on CAQH official website, and also our support address is available on our website, where you can just chime in and provide us your query, wherein we'll be able to help you out to answer the appropriate registration process and help you through with that process as well. So right now I'm going to drop off with this process and not log in through, rather provide you a walkthrough of the process. How does it look like when you actually register and get through it? So I'm going to log in with a test account available, which will provide you exact same experience which a person would have, or organization would have once they log in. So as you can see with your on your screens, as you log in through EDIFEX Certification Testing Portal, once you have registered, you would receive the email notification of confirmation of your request being received with EDIFEX of registration. And that request comes to us as the support team of Core Certification Portal, where we review the details of registration which has been requested and approve your account with enrollment of relevant testing tasks and programs. So with your home page, as you can see, we allow you to have the Core step-by-step certification process link. You can have the link to Core Pledge and the Quick Start Guide, which can solve your purposes of answering basic questions or FAQs that you might be requiring at the start of your testing process. As I reach out ahead, there is a section called Programs, which is the most key area and the important area of your testing process. As you can see, currently your account shows 4 testing programs available in this account. Not all testing programs may be applicable to your organization at the first place. We'll be enrolling these programs and the testing tasks according to your stakeholder type and the transactions that you're dealing with. So at any point in time, if you have any questions or confusions of the transactions or the core seal that you supply, please reach out to us so that we can enroll you the correct and appropriate testing tasks and programs. And this process is self-paced and a very easy process where you can go step by step and reach out to the testing tasks ahead. So as you see, I've gone into one of those programs which talks about information source real-time program. It provides you the testing steps. It provides you the instruction of how should you complete the testing steps. And not only that, before you want to start your testing, you see a section of FAQs available on the left-hand side menu. While I walk you through FAQs, this provides you a list of documents and all the request files, guidelines, test suite, which might be helpful for you to set up your testing accounts, testbed data, or connectivity at your end before you start the testing tasks with us. So at any point in time you want any reference of material, we have it available in your account on testing portal. And as we reach out, there is a link available where you can reach out to Edifex support team, which is here. It says add an issue. I'll just take you through this, and I'll always recommend you all to use this section to reach out to Edifex core support team as and when you fail any task or you want any answer to any of your questions. This might be any question regarding to your stakeholder type, transactions, or task failures, or any of the validation issues that you must be facing at time of your testing. So it's a simple process where you just log an issue. This notifies not only you with an email, but a team of subject matter experts on technical and functional sides to Edifex, wherein we can reach out to you, help you out not only with the certification process, rather any point in time if you want any additional services or solutions to get you core compliant, which might be come with an additional cost, but we can help you out through the complete end-to-end service processing of this core compliance method. I'll take you through the testing steps of the testing programs. So as you see our screen for information source real-time tasks, it contains the task of all the testing steps that you might be required to complete your testing process with Edifex. Again, these tasks will be enrolled and allocated to your account according to your stakeholder type and your transactions that you'll be dealing with. So these are pretty simple tasks where you just go inside, read the instructions which are available. We have provided a descriptive manner of each task wherein we provide the instructions, processes, and the steps to complete those tasks. You upload your steps and mark them partner steps completed for us to review at certain point in time, and you'll be able to pass them easily. I'll walk you through with the tasks which are available for the connectivity methods, where you would want to have a look at how your transactions would be exchanged between Edifex and your system. So as you see a task which is dealing with 270 and 271, you would have a wizard-based testing process wherein you provide the details of your environment from where the transactions would be coming and the responses would be generated. So we have these transactions in here wherein we not only provide the request file available here for you to verify in your system and check through it. Rather, we have a detailed error report and the response file which was generated to ensure that we set the correct expectations with your system, that what expectations has been set with this system to comply with the test case and complete them accordingly. I hope this helps at any point in time, and for any matter you would want to call us. You have our numbers, you have our email addresses, you'll have the issue section on this portal, and to reach out to Edifex for any issues that you might want to have. And additionally, as if you have faced out any issues configuring your account or setting up your profile correctly, we provide a section of managing not only your accounts, rather your user accounts as well on the top right corner of it, wherein you can go ahead and manage your testing accounts and also add more users to your testing accounts. So if your organization has more users who are accompanying or shouldering the responsibility of testing with a person, you can add multiple users to the same account so that this process can be expedited at your end. And as we see a list of multiple tasks here, for a specific programs. So as soon as an organization is able to complete all the tasks available in your account, your testing would be completed. And not only that, we have a reporting engine, automated reporting engine running at back office systems, which generates a completion and applicability report of your testing, which is being sent out to CAQH within 24-hour span as soon as you complete your testing. And to explicitly call it out, with a specific request of your completion applicability report, we can share a copy of that with you as well. So if you want that, please reach out to us and we'll share a copy of your completion and applicability report. So with this, you have these takeaway points with you. One, you know where to reach out with EDIFACT for the testing solutions, for the EDIFACT Core Certification Portal. And not only that, since we shoulder and share a great relationship with CAQH on OR compliance, we have other solutions, service offerings, and customized solutions which can help you to get OR compliant and get you through the certification process. And secondly, I think this process in the certification portals is pretty simple, wherein it provides you all the relevant details that you might require for certification or testing process or on documentation perspective. So feel free to reach out to us, add your questions, add your queries to us. We'll be able to connect you back with email conversations, chats, or we can get onto a call to solve any of the purposes that you might have. I think here I'll leave back to you, Jessica. It was so, thank you. I'll thank you to setting us an opportunity for us to present this in front of all. Thank you so much.
Thank you so much, Puneet. That was really helpful, and it's great to be able to see it live. Let's go to the last polling question, and hopefully after that we'll be kind of quick, and we'll have some time for Q&A. So here's the last polling question. What types of educational resources would you prefer to learn CAQH core subjects? The answers are webinars such as these, text documents such as FAQs, short informational videos, or interactive e-learning information modules. So I'll give you a few seconds to answer. Let me give you one more second. And we're almost at a tie here. I mean, it's good to hear that the webinars are well received, and we will continue to offer those to you, as well as our FAQs that we continue to post on our website, and we'll make sure those are always up to date. But it's helpful to hear from you guys that these other educational options are things that we should consider and continue to use. So thank you so much for your feedback. And now let's take some time for Q&As. Again, please submit your questions by typing them into the questions panel on your dashboard, and please identify your organization. I don't think we're going to have time to take audio questions, unfortunately, because we already have received a bunch of questions ahead of time. But hopefully we'll be able to do that next time. So Matthew, did we get what was our first question?
So we actually had a question on when people registered, and this is a question we get often about what is the cost of core certification. And I thought I'd swing it back to you, Puneet, and talk about from the EDIFACT point of view, in terms of registering for that site that you showed, what is the cost for on that EDIFACT performance testing?
Thanks, Matthew. It's a very interesting question that we often get from all the organizations. So registering with EDIFACT testing portal and getting started with the testing process comes at no cost. That means registering and testing with EDIFACT testing portal for phase 1, 2, and 3 is free of cost. So you can go ahead and complete your testing with our help there. But if you want any of the services or solutions that you want to assist you. Additionally, to get you core compliant or expedite your process, we can talk through those services which come through with an additional cost. But to get started with Edifex, it's free, and we welcome you there. Thanks, Matthew.
Thank you, Puneet. That was very helpful. And then from the CORE certification, CORE is the administrator and the reviewer and the awarder of the CORE seals. Taha, do you want to talk about the cost there?
Sure. CORE certification, the fee to actually apply for the CORE seal itself after you complete the testing with the CORE seal application process, there is a stakeholder-specific fee scale depending on the organization type that you are. So health plans may have a different fee structure than a vendor, and that fee scale varies between the cost is per each phase of certification. But I also like to point out that the fee structure for government Medicaid, such as MaineCare and the organizations that we talked about today, the governmental organizations, there is no cost for CORE certification. That CORE seal fee is waived for government agencies.
That's great. So for some of our audience that are in Medicaid, that's no cost on the Edifex site and no cost for the CORE certification fee. That's great. The other question that we had, certainly at registration, we get this interested a lot, was what is the status of the ACA mandated HHS health plan certification? And Pam referred to the HIPAA credential, which was part of that proposed rule. We've got no new news on that. Again, like Pam mentioned, it's a proposed rule that has not been finalized, which means that legally that December 31st, 2015 is also not been finalized. And as far as the HIPAA credential is concerned, that's the form, and it's the second option in that proposed rule for the documentation of compliance. Until that rule has been finalized, that credential form has no standing. There's nothing to do with it. So certainly CAQH CORE has worked on with industry on creating that form, but we won't finalize that form again with our industry stakeholders until we see that final rule. So that's about all we know. All we know is what we hear from coming out of CMS.
Cool. So we have time for one more question, and the question is, could you share some details around the effort to load the Testbed data and any lessons learned? Hopefully, some of our colleagues from Maine can answer that question. Kelly or Roger, could you provide some information on that?
Sure, I can. When you first look at the Testbed data that's provided, at least for MaineCare, it was a challenge to understand, okay, am I supposed to actually load these members into my test environment, or am I supposed to find members in my test environment that are similar to what this data is? So once we got a handle on what you had to do was actually load those members with those criteria into your test system, you know, we had some manual work to make that happen. We actually keyed those member IDs, those member addresses, all of that information manually into our test system. We did not find an easy way to automate that load, so it was manual work for us. And then the Testbed data that's provided is applicable to any sort of health plan and Medicaid agencies. I think one of the speakers earlier spoke to this, are a little bit different generally when it comes to copays and coinsurance and deductibles. So some of the criteria didn't really fit what MaineCare policy states. So we had to sort of figure out how do we load this in. It's not applicable for MaineCare doesn't have deductibles. So do I load this member, assign them this benefit plan when we don't have deductibles? This doesn't make any sense for us. So we did a lot of consultation with the CAQH CORE team on that data to help us get that figured out and get that data established before we started the testing process.
Thank you so much. And we are unfortunately out of time. We will I want to thank the speakers. Thank you so much for sharing your stories with us, and thank you to our participants for joining us. The last slide are some takeaway slides. I will not read them, but I hope that this was informative, and we'll see you again during the next webinar. Have a good afternoon. Bye-bye.